Welcome back. Amid growing concerns expressed by countries and WHO over the raging COVID surge in China, the country's foreign ministry came out in defense of its handling of the situation. This comes after WHO chief warned that China is underreporting actual number of infections, hospitalizations and deaths. Foreign ministry spokesperson addressed a press briefing in Beijing where he said that the country was transparent in sharing data with WHO, though China has relaxed its restrictions despite the spike in cases. Several nations, including India and the European Union, are tightening norms for travellers coming in from China. Let's open this up to Ananth Krishnan, China correspondent of the Hindu, Jeniffer Zeng, Chinese human rights activist. Thank you very much for joining us. Jennifer, if I could begin with you, the WHO has warned the world that China is underrepresenting the number of cases of COVID and the deaths resulting from it. According to you, what could be the extent of the COVID situation, the COVID outbreak that we're now seeing in China?
Yes, I think many Chinese experts or observers have made this conclusion or observation that the official CCP number sometimes could be 10,000 less than the real number. So according now, the National Health Commission of China has stopped releasing COVID-related figures. Now many provinces are releasing their own figures based on survey because they've stopped doing the tests. So according to the survey of many provinces, at least in Sichuan province, they openly admitted that the infection rate is already over 60, and now that was several days ago. So now it could be over 80. And also from many, many people who share their individual knowledges about what they know about the infection situation around them. So now it is widely believed that the average infection rate of the entire population could be somewhere between 60 to 80, even to 90% of the population.
All right. Let me just take that to Ananth Krishnan as well. Ananth, what are the numbers that have been shared by the government, by the Chinese government in their daily briefings? What is the latest number of deaths and the number of COVID cases? And are you actually seeing hospitals, the healthcare system getting overwhelmed?
Parikshit, just to give you a sense of the situation here in Beijing, it seems to me that the peak has passed in major cities, including Beijing, and surveys that institutions here have conducted, including, for instance, schools, have estimated as high as 70% of people in Beijing as a minimum already infected in the past 1 month. There is no credible data on daily cases because they've stopped testing. There's also no credible data on daily deaths because the criteria for COVID deaths, as the WHO said, is too narrow. And many elderly deaths that even we have heard of here haven't been classified as being caused by COVID because they have underlying conditions. But what I can tell you, Parikshit, is that even if I think the chaos that we saw from 2 weeks ago is somewhat eased because the peak has passed, it's very clear that there's been a huge number of elderly deaths from what you see from crematoria in Beijing and other cities in China. Recently, Parikshit, someone that I know who lost a relative in Beijing was telling me that there's a waiting period right now in the Chinese capital for 10 days for having a body cremated. And that's because crematoriums are pretty much working overtime. So there's no doubt that there's a huge number of elderly deaths, given that there are 12 million Chinese above the age of 80 who haven't completed 3 doses that are needed to prevent hospitalization and death. And the numbers, of course, aren't reflecting what you're seeing among elderly deaths. There's no doubt about it. And the second worry, Parikshit, right now is even though the peak is past and you're seeing some normalcy in cities like Beijing, traffic is back, restaurants are full again. The problem now, Parikshit, is that there's a fear of these infections spreading to rural areas because many Chinese will be going home for the Chinese New Year holiday on January 20th onwards. And even though resources in Beijing have been stretched, the situation will be far worse in smaller towns which have nowhere near the hospital infrastructure that even big cities, which have been overwhelmed, have. So I think the next 1 month, 2 months is going to be a very rocky period here in China, Parikshit.
Right. Jennifer, to come back to you, as Ananth was pointing out, and Ananth is reporting from Beijing, that there is a fear now of the COVID outbreak spreading to the rural areas. Which parts of China, according to you, have been the worst affected so far?
According to the internal document of the National Health Commission, of course, that's not openly published. I think they initially said Beijing and Sichuan province as the most, heavily affected provinces or cities. From what I see on social media, I think a lot of cities have already been affected, like Sichuan province, Henan, Hunan, and even to the southern part of Guangdong and Fujian. That's the most southern part of China. Of course, the situation in the northeast China was very very bad from the very beginning. So it seems like the entire China is affected or is and in a very quickly fashion. And that is another problem that I think puzzled many people in China. Now, I do agree that the situation in the countryside would be much, much worse than in the big cities because the lack of the conditions and the medical resources. And in the past few days, I've shared some videos of, in the countryside, people have already burned the dead bodies, in the open. And also, like yesterday, I shared one video of on a very short street, there were at least 8 families holding funeral services for their loved ones. So in that condensed, it's only maybe about less than 500 meters distance. 8 families were holding funerals to their families. That was, I think, in Guiyang City in Guizhou. So that was southwest China. So now I think the situation is very serious in entire China.
All right, so you're saying that it's a serious situation across China. Ananth, coming back to you, do you see the Chinese government taking any such measures? Yes, there is a certain amount of euphoria, happiness about the economy opening up. People can go to malls, they can travel openly. But at the same time, there is a fear that the controls have been eased too quickly. Could we see some measures being taken by the Chinese government? And also, do you expect some sort of retaliation against India and other nations who have started imposing some amount of curbs, testing curbs on travelers coming from China?
Well, Parikshit, there were new health protocols. The 10th edition of health protocols was released in Beijing just today. So I don't think from what we see from those protocols, it's more easing. And I don't think they are going to go back to putting restrictions that we've seen here for the last 2-3 years. It seems to me that I think their best sort of hope is to let it spread as quickly as possible, to achieve herd immunity, and to get people back at work and the economy back ticking by the second quarter of next year, since probably Q1 of 2023 will be a write-off. So I think their best sort of hope is to just get it over with and kind of metaphorically rip the Band-Aid off, so to speak, even though that's going to mean mass deaths among elderly in the short term. And I think that in terms of measures that they've warned, it's difficult to see what they will do, Parikshit, because even with China's opening on January 8th to international travelers, China itself is requiring all foreign arrivals to take PCR tests before traveling to China. And that is the requirement that other nations are asking of Chinese travelers. So in that sense, I think some officials that I've spoken to from other countries are a little bit puzzled, given that China itself is going to be asking for that requirement. But at the same time, I think that Parikshit, health experts are saying that so far there have been no new variants discovered in China. I know there's been some alarm about this in India, but the reason for the spread, most cases here have actually been mild. But the reason it spread so fast is because essentially a first wave nationally in China, and it's a population with low immunity. It's not that so far, at least, and hopefully you won't see a worse variant that's emerged. But so far that hasn't happened yet, Parikshit. That's something that we should also note.
All right, we've run out of time, but Ananth Krishnan, Jeniffer Zeng, thank you very much for joining us here on Global Eye and explaining us the worrying state of affairs with the COVID outbreak in China. With that, it's a wrap on this edition of Global Eye. Thank you for watching. Goodbye.